Good morning, everyone, and welcome to our webinar. Again, my name is Courtney Austin, and I'm the marketing coordinator here at AIM. Today's webinar will be recorded, which does mean that all attendees will automatically be muted so that we can get a quality recording to later post on our website. If you do have any questions throughout the webinar, feel free to go ahead and type them into the chat box, and we'll have a member of our marketing team reach out to you individually after the webinar to answer any questions. So with that, I'll go ahead and hand it over to Carlos so we can get started. Go ahead and take it away, Carlos.
Good morning, everybody. Yes, my name is Carlos. I'm the marketing manager for Medicare with AIM. In today's fully loaded webinar, we're going to go over why comprehensive Medicare Advantage makes sense for your clients and strategies for the newbies as well as the experienced agents to power up your book. From current basic talking points of Medicare 101 to a deeper dive into how to position yourself for massive success with Medicare Advantage. So it's a two-part story. Number one, it's much more like the insurance people have through their employers than regular Medicare. It's significantly less expensive than traditional Medicare and a supplement. Example, Washington with the Plan G, Medicare MedSup Plan G is roughly around $2,400 a year, plus $400 for prescriptions, plus $2,000 for your base Medicare cost. We're going to talk today about Medicare Advantage and how it does much more for seniors than just original Medicare and is considered by CMS to be more comprehensive coverage than original Medicare and a Medigap policy. The benefits of HMO, large networks of primary doctors and specialists, hospitals to choose from. PPO gives your clients more flexibility and freedom nationwide to see providers either in network or out of network, but may cost more when going out of network. Part D is already included in the Medicare Advantage plan. Makes it easy for your clients not having to worry about not having credible coverage. That's the beauty of Medicare Advantage. It's an all-in-one, A, B, and D. It's always important to select a primary care provider for your client that is suitable to their needs, family physician, internal medicine, etc. Not only are there plenty of zero premium plans, but also plans that are specifically designed for seniors with chronic conditions where they can get coordinated care that will best meet their needs for any treatments, prescriptions, supplies, and durable equipment that they may need. Yes, it's true, there are plans that offer zero copay for basic and comprehensive dental, hearing aids, and vision benefits. And some other plans feature zero to low copays for these benefits also. As we continue to talk about the comprehensive nature of Medicare Advantage plans, we will see that not only are there zero to low copay for primary care doctors and specialists, but there are even some plans with zero to low copay for hospital. This all comes with the beneficiary's Part B, $170.10 premium. All the preventive services are at zero copay. Meals can be provided post-surgery. Also, some plans have unlimited transportation for appointments and to pick up prescriptions. Outpatient can be covered at zero to low copay. Yes, the Part D is included in the Medicare Advantage plan. I'll be a little technical here, but it's good for you to know how it works. To save money, mail order prescriptions is the way to go. Also makes it more convenient to order by phone. No more long lines at the local pharmacy. Tiers 1 and 2 can be zero copay for a 90-day supply, with tiers 3 and 4 still getting a small mail order discount. Now let's unpack the 4 stages of the Part D. Stage 1, if the plan has a deductible, that must be paid first before the insurance starts paying its cost. Stage 2 is the initial coverage, is where most beneficiaries will be if the prescriptions are less than $4,430 annually. After their total drug costs reach $4,430, they now enter the coverage gap. They pay 25% coinsurance for generic drugs and 25% coinsurance for brand drugs during that coverage gap. After the yearly out-of-pocket cost, including drugs purchased through a local retail pharmacy and through mail order, reach $7,050, they will pay the greater of 5% coinsurance or $3.95 copay for a generic, including brand name drugs that treat it as a generic, and $9.85 copay for all other drugs. Now let's look at the market snapshot. 2022 forecast, Medicare Advantage is the hottest market. Don't expect that to change. In 2021, 26 million Medicare beneficiaries, or about 42%, almost half of those eligible for the program, were enrolled in a Medicare Advantage plan. CMS, Medicare Advantage plans with 4 or more stars skyrocket in 2022 compared to 2021. Here's the hard numbers about where the market is, riding the horse in the direction it's going. The estimate of a 70% increase in Medicare Advantage enrollments between 2030 and 2040 is backed by the rate at which Medicare Advantage is penetrating urban and rural counties. Now we'll go over the types of plans and other features. Now let's look at the various types of plans that are available to your clients. First, I would like to point out that the Part C Medicare Advantage plan is an all-in-one plan encompassing the Part A, the Part B, and the D. Unlike original Medicare, it features a maximum out-of-pocket, meaning the maximum expenses are predictable, which means less surprises. Most common, we will see HMO and PPO, but there is also HMO POS plans. For a hot all-year-round market, let's talk a little bit about chronic SNPs, special needs plans, and dual-eligible special needs plans. Both plans are trending to grow substantially over the next decade and beyond. So get on this bus or you might just get run over. Heads up, dual-eligible special needs plans can make changes 4 times per year, and chronic special needs plans can change any time during the year. Now we'll talk about the enrollment periods for Medicare Advantage. Most of your clients can enroll in a plan during these periods. The initial enrollment period, when you're first eligible for Medicare, for example, when you turn 65, you have a 7-month window to sign up for Medicare for Part A or Part B. Medicare Advantage plan. This time is 3 months before your birthday month, and 3 months after your birthday month. Annual enrollment period. That's October 15th to December 7th every year. During this time, you can switch, drop, or join a Medicare Advantage plan or enroll in original Medicare and a prescription drug plan. And we're here now, of course, in what's called the Medicare Advantage open enrollment period. It's January 1st to March 31st every year. This is your only opportunity outside of annual enrollment period to switch to Medicare Advantage plans, or during this time you can switch to a different Medicare Advantage plan, drop your Medicare Advantage plan and return to original Medicare, Part A and Part B, sign up for a standalone prescription Medicare prescription Part D plan if you return to original Medicare. Most Medicare plans already include a prescription drug plan. And there are specific circumstances where your clients are eligible to enroll in a Medicare Advantage plan any time of the year. I will mention just a few here so you can have a better understanding of a special enrollment period. Have you recently moved to a different county or state? Are you currently receiving extra help with your health care costs? Have you recently retired or lost your employer or union coverage? Are you currently receiving Medicaid? Have you been affected by FEMA weather-related natural disaster? If so, you qualify for a special enrollment period. Now we're going to talk about the dual eligible. This market is trending to have very hot growth over the next 2 decades. So we're going to talk a little bit about how that's going to work out for your practice. First, I want to say that if you're not on this bus, you're going to get run over by it, because it is and will be for some time an incredible market that you should be part of your portfolio for your clients. 2 huge dual markets in one. First, we have the full benefit dual eligible and also the partial benefit eligible. Enrollment in partial benefit eligibility categories outpaces full benefit categories. The number of partial benefit dual eligible beneficiaries increased from 1.8 million in 2006 to 3.5 million in 2018, a 5.6% increase. This rate is almost triple the 2.0% among full benefit dual eligible beneficiaries. According to a report by America's Health Insurance Plans, Medicare Advantage presents dual eligible individuals with an option that is affordable and has the ability to detect, treat, and prevent the progression of chronic disease. The bottom line is that full and partial dual eligibles are growing substantially in urban and rural markets, And with richer plans being offered every year, you can't afford to miss out on this unique Medicare wave. Now we'll talk about some more features here. So with diabetes, congestive heart failure, and COPD on the rise, you want to move towards plans that are designed from the ground up to serve the needs of these types of clients. These plans feature devices, supplies, and prescriptions at zero to low copays, and all integrated care so that your client can be diagnosed correctly from day one and provide the ongoing monitoring of their progress. Regarding home health care, it's an included benefit and may require the provider to obtain prior authorization from the plan for this benefit. Part B, give back premium reduction can be like putting up to $1,500 back in your client's annual Social Security check. They're going to love that. Okay, I'm not saying that we have to get in shape like a UFC fighter here, but there comes a time when we need to get serious about our game and invest in ourselves and do the hard work and up our skill mastery to achieve the big success we really want to see in our life. I love Kobe Bryant's mindset, and as you all know, he was never a normal or average player. Let's also strive to be more high performance in all that we do in business and family and personal. Yes, anytime we attempt big changes in our life, there will be some pushback. Pressures and challenges will be there, but we can view it all as an opportunity to flip the script and rise even higher. Well, why sell Medicare Advantage? I strongly believe that every broker needs a base of residual income to create long-term sustainability in their practice. Residual income is a beautiful thing. For just maintaining your book of, and keep getting paid every year after year. Also, in managing your book, it shows you care about your clients. And you also have great opportunities to cross-sell, ask for, and get referrals. All this only helps build stronger client relationships. Selling Medicare Advantage can steadily help you build six-figure residual income in as little as 4 to 5 years. At that point, you'll have a great six-figure passive income that is on top of all your current weekly and monthly commissions. What's not to like? Having a residual income gives you the flexibility to stretch your capabilities and begin learning how to cross-sell other product lines and strategically round out your book of business over time. Medicare Advantage can pay up to full commissions up front, putting more money in your wallet with every application. Now we'll talk about the more features of Medicare Advantage. It really is true. Zero premium plans are king. Makes it easy for your client to enroll with no worries of added monthly premiums. And on top of all that, hospital and medical benefits your clients get, they will love these added benefits. Routine, comprehensive dental, hearing aids, zero to low copay, and even some plans have up to $600 of vision benefit for eyeglasses, contact lenses, and routine exams. And some more features for Medicare Advantage. Now let's look at some of the great added value items that you can give your clients with a Medicare Advantage plan. One of the hottest new benefits is over-the-counter benefit that gives up to $350 per quarter for wellness health products, and even get grocery cards for healthy food items. Gym memberships, all the major gyms are included. With literally thousands of primary care doctors and specialists to select from, and with many of your clients' primary care doctors already in the network, it really makes enrollment easy and almost seamless. Also, your clients are not stuck with small community hospital. There are many options, top-tier hospitals, cancer centers, specialty clinics available. If your client has a chronic condition, they can utilize the chronic special needs plans and get much more in terms of coordinated care so the progress can be monitored and adjusted as need to be, and have zero copay for supplies, devices, and prescriptions. And here's some ways that you can change plans all year long, so that way you're always doing business. Here's a big one that a lot of people overlook. The big benefit of a 5-star plan is have over competitors that beneficiaries can change with their plan any time during the year, whereas most others will be in lockdown mode. Dual eligible Medicare, Medicaid, once per quarter, and chronic special needs plans can change all year long. This is a super hot market to keep in your quiver. Turning 65, only 11,000 seniors turning 65 daily. It's a tidal wave that's not going to go away for a long time. Beneficiaries that delayed Part B enrollment, still working, group union coverage. Now, as many beneficiaries and spouses are retiring, it's a big opportunity to assist with their Medicare Advantage plan. With so many natural disasters throughout the country, it creates a FEMA weather-related special enrollment period. Again, another opportunity to assist with Medicare Advantage review and new enrollments. Here's one that many overlook. A permanent move out of their service area creates a special enrollment period to enroll in a new plan in their new service area. Crush Medicare Advantage in 2022 and start living the life of your dreams. So this is just a picture of some of our dreams here. Definitely, I think we're going to reach that, of course. And this is our carriers here. As you can see, we have Aetna, United Healthcare, WellCare, Humana, and Medigold. Cigna is a hot play for MedSubs, but it's not here because it's non-commissionable for Medicare Advantage, and you won't make any money. And the thing is, we're going with the big nationals because so you don't have to recertify with all the small carriers every year. And here's some takeaways. Contracting certification, top plans in your area, start the conversation. Call me today at 800-672-7202 to get contracted with these great carriers. And one disclosure, not all the plans benefits mentioned in this webinar are available in all states or counties. Check your target market for the plans and benefits in your area. Thank you all for joining. You guys all have a great day and a great morning.